Good evening, everybody. It's an absolute pleasure for us to be here with you today to share with you some exceptional insights from an absolutely amazing rock star panel. You guys are in for a real treat. We're just going to quickly go over some basic guidelines before we get into it. I'm sure you guys are all pros at this, so if you are not on the panel, keep your audio on mute. I do believe we are going to have a segment for Q&A. So when we get to that point in time, think about what your questions are. I'm sure you're going to have a lot of questions. But think about what they are, write them down, etc. And then when we get to that segment, over to you, because we really want to have great engagement with everybody. And so with that, I'm also just going to remind my amazing panelists that we're going to be keeping to time. So let's try to stay on point. I know you have a whole lot of information to share with our colleagues today, but I'm going to ask you to stay on point. And so with that, thank you so much, everybody. Of course, this panel is going to be all about not just healthy aging and longevity, but specifically how can we utilize and structure global partnerships and with strategic partners and investors to really accelerate commercialization. And so with that, my name is Lisa Lambie. I'm going to be the chair for this panel. I am the managing partner for Maroon Venture Fund. Maroon Venture Fund is a US-based venture capital fund investing seed to Series A+ in, drumroll, healthy aging and longevity, specifically to advance precision medicine and preventative health for chronic health conditions. We also have an affiliated research institute, which is based out of the US, but which is global in 15 countries to advance the innovation of protocols and preventative methodologies. And so with that, I'm going to turn to Paola and ask her to do a quick introduction, and we're going to go around the table.
And good morning, good afternoon, everybody. It's a pleasure to be here, and thank you so much for the invitation. I'm really thrilled to be in this discussion. This is so exciting. So I'm responsible of patient experience in Japan at Johnson & Johnson, but I'm also a co-leader of our Smart Healthy Aging Initiative, which is an initiative that was started in Japan to really extend the healthy life expectancy and improve the quality of life of the elderly population. So you probably already know that the Japanese population is enjoying one of the longest life expectancy in the world, with more than 81 years old for men, more than 87 years old for women. And you know as well that we have done incredible progress in extending the life expectancy overall in the world within the last centuries, thanks to all the technologies and innovation that we had in medicine and public health. But we really didn't do many progress into, narrowing the gap that exists between healthy life and life expectancy. So it remains like this 10 years gap, which we call the lost decade, which are basically the last 10 years that people spend on their life, and they're generally spent in unhealthy conditions and with lower quality of life. So this is something that is incredibly important to narrow this gap, and extend the healthy life is incredibly important, not only for the individuals, but also for the society. So with the Smart Healthy Aging, we are trying to address this. We are establishing partnership with other industry, with local government, with institutions, hospitals, to partner together and to create innovation that can address that gap.
Great. Paola, thank you very much. Over to Shalya, and just remind you have 2 minutes to just do a quick introduction.
I would remember that. Good morning from the Netherlands, and a warm greetings to everyone joining from Japan and across the world. I'm Dr. Shalya Anand, a clinician, researcher, and a health economist working at the intersection of oral health, healthy aging, and health literacy. For over 3 decades, my work has explored how oral health, often overlooked, reflects overall well-being, and particularly in older adults. Healthy aging is not just about adding years to life. It's about adding vitality, connection, and dignity to those years. And it's invisible, but it is tied to these outcomes, influencing nutrition, speech, and social interaction, and self-esteem. My research connects behavioral and economic sciences with policy innovation, reframing aging as a space for opportunity rather than a burden. At Max Planck Institute, as a researcher, we are developing dental boosts, behavioral interventions to strengthen oral health, while in India, I lead the Smile Age Initiative, a program that integrates AI-driven screening, preventive care, and digital inclusion for older adults. In this, what I'm trying to do is, through community-based networks and non-dental caregivers, we extend access to oral care while generating population-level data for predictive modeling. And as a health economist, I view preventive oral health not just as a cost, but as a long-term investment that builds health span and efficiency in healthcare systems.
Thank you very much. Hiromi, please introduce yourself.
Yes. Ladies and gentlemen, good afternoon. I'm Hiromi Komuro, VC President of the Japan Metaverse Association and the Chairman of the IEEE Digital Transformation Association Japan. I'm honored to be here today. Thank you so much. We can join the Japan and the MedGlobal conference. Metaverse Association, we are do some the AI and digital twin and MR, XR, VR. Like this technology, we are do some the more product and also make some the project is other do some the detail and can help the economic some the project. So this time we can talking the AI make some the product give the medical and also give some the elderly and aging the more the AI can collaboration can do some of the technology to each other can make this new value. Thank you so much.
Great. And Masato, if you can round us out.
Sure. Ladies and gentlemen, hello from Tokyo. My name is Masato Marumo. I run a startup called AI6. What we do is we use Wi-Fi sensing as a new technology to create a 24/7 totally private aging in place solution. And what we are trying to do here is to not only detect some urgent situations such as falls and stop breathing, but also having interactive intervention to the elderly, as well as providing some predictive solution for failure, which leads to prevention of dementia, which is driving a lot of social cost, as you well know. It is quite a new challenge. We're still at a seed stage, but some of the early prototypes are showing promising results. So we are trying to bring this to the market in next 3 to 6 months.
And Masato, can you just touch quickly on just leading on from what Paola had started to describe for us, just what is the environment in terms of Japan and healthy aging and longevity, very well respected globally as a leader. Can you just set the stage for us?
Sure. So as you all know, Japan stands at the forefront of global demographic change. Nearly 30% of our citizens are age 65 or older. And by 2035, 1 in 3 will be seniors. And this is transforming nation's economy, healthcare, and communities in a big, big way. And as Paula says, while the life expectancy continues to rise, the gap, the 10-year gap, the last decade, is becoming one of the most critical, urgent national priorities. And in addition to that, beyond medical costs, a hidden burden of presenteeism is the productivity loss and millions have to balance work and caregiving is eroding the economic activity in a big time. So yet Japan is not merely a social society under pressure. It is a living lab, if you will, for longevity innovation. As the world's first super-age nation, Japan has the opportunity and the responsibility to pioneer solutions for aging societies elsewhere. Achieving these demands is unprecedented collaboration among government, corporations, startups, and investors. And I think that's what this panel is all about.
Fantastic. Thank you so much for that. Okay, so we're going to go right into the crux of really what we're trying to drive home today. We're going to talk about it in two areas. It's all about how do we build effective partnerships, both with strategics, as well as drive investment. Of course, ultimately, research isn't helpful unless it actually is commercialized. And that's really what this panel is all about. So on the partnership side, just a couple of points before we turn it over to Paola and the rest of the panel here. As we know, and as all the panelists have referred, we are at a critical juncture in terms of aging, health span, i.e. the quality of our health, and longevity. The way to go is to eliminate these innovation silos globally, start working closely together, and that will lead to not only better outcomes, but more efficient outcomes, cheaper, and in a much more timely way. And so that's why we're really trying to drive these partnerships. We are trying to also get rid of a lot of the noise out there and get really down to the science. So companies that are globally integrating with partners are going to be the ones that succeed and are able to leverage the resources, the data sets, and the like, and the resources across jurisdictions. Of course, there's going to be constraints. There's constraints with regards to operating environments, regulatory environments, etc., bureaucracy, but the benefits way exceed any costs. Also, it's going to provide companies and innovators with better access to data, larger data sets, and much more diverse data sets. And so with that, I'm just going to turn it over to Paola, who will go into a lot more detail around corporate partnerships using Johnson & Johnson as an example.
Yeah, thank you, Lisa. I think what you said really is important because partnership is the core, strategy for addressing healthy aging. Healthy aging is such a, a complex challenge. There are so many contributors. If you think about how can we achieve healthy aging, definitely there is like, a physical health component, a mental health component, but also we need to think about, caring for the aging population. We also need to think about, creating the spaces, the environment that allow the independence of the elderly population. We need to think about, financial stability. We need to think about, many, many things. So addressing all these things is something that nobody can do independently. So definitely, I think partnership is the key strategy there. And actually what we envision is to create an ecosystem of partnership, an ecosystem of different partnerships that can address all the different unmet needs of the elderly population. And in that way, we generate innovation at the same time. So every time that we tackle a different challenge, of course, that's an opportunity for creating innovation. We have seen it with COVID. I think, healthy aging is also, a big challenge and a big opportunity at the same time. So what we are doing, how we are starting J&J with the Smart Healthy Aging is to start establishing, as I mentioned before, partnership with, the government, with other industry, with academia, with hospitals. And the way that we use this partnership is to really drive innovation catalyst programs for healthy aging. So there are, I would say, 3 key areas that we are focusing those catalyst programs. One, I would say, is around generating insights through data analytics, through clinical observations. So those insights, what I mean with generating insights is, for example, uncovering what are the elderly health issues, the multimorbidity challenges. Because when you think about the elderly population, we know that 50% of the Japanese elderly population, they have at least 4 or more chronic health disease. So you cannot really approach their health at the same level as just at the single disease challenge. So you need to look into the holistic approach and think about holistically what are the challenges for them in their situations. So understanding what are their challenges, understanding what are the drivers for disease prevention, the drivers for early diagnosis, for optimizing the intervention for this population is also very important. So we generate all these insights and we translate those into key needs. And then those key needs are feeding back into our R&D, but also are feeding back into our strategies at every time of our life cycle.
Great. Wow. Wow. I wish we had more time. And please remember that we are going to have Q&A coming up for all of these amazing experts. So please have your questions ready. So moving on to Hiromi.
Yes.
AI is just revolutionizing precision medicine and preventative healthcare. Not only are we getting to potential solutions faster, but the caliber and the quality of clinical trials and outputs has been accelerated. Can you touch a little bit around what you're doing in the AI and tech space, specifically as it relates to knowledge transfer and building partnerships with Japanese companies?
Thank you so much. So yes, Japan have a lot of the older people and the grow up. So we are association make some of the AI who can give the somebody take the different value. AI can plus make the different product, can give the some of the people can the emotion and can take care also the and take care somebody. So another and digital twins like this the data. And Japan also make the bigger data center. The data center maybe after can join different the data from the physical exhibition and the center and the hospital and the nurse, the home, and the data center. This data can make a different value. Data answer is using from the research in the different fields to carry value. Data also provide to medicine research and development. So how can using the data and it's not only the one company can do it, one center can do it. We eat the ecosystem. So also different partnership can join to each other, can take the data, make the different parts, can give somebody is a different product, also can make the different value. Also, Japan government have the make the data center, also the university and some of the hospital and different company can join to each other, can take this data, can make some of the different new product and give somebody can help the somebody and to make the something. No, and we are actually make the one AI local as AI can talking and AI toys. So the toys is very local is normal, but plus AI maybe we can make the different value, give some of the people can breed the take care the health. Also, some of the young children and older people can is lonely. It's lonely. Maybe AI make the toys can talking and can give the
Hiromi,
different.
thank you so much. Thank you so
Yes,
much.
thank you.
We're going to
Okay.
just stop there, and we might come back
Okay.
to you towards the end of the panel. Masato, you have been an investor. You have been such an innovator and a pioneer across so many spaces, and also now you're an entrepreneur. So can you share with us your insights around some of the chronic conditions that you are tackling with AI and tech?
Sure. So what we are doing specifically is using the Wi-Fi radio as a media to become a sensor. So if you realize, Wi-Fi radio is everywhere. You're essentially swimming in a pool of Wi-Fi radio. So every single move you make makes a ripple, changes the ripple. And we're utilizing deep learning AI to be able to detect what exactly the movements are. And we're using this analysis and movement analysis platform to actually detect early symptoms of failure and also early symptoms of dementia, because dementia is one of the deep-rooted social issues in Japan and worldwide. There's a figure that done in 2014, the social informal cost of dementia is about 6 trillion yen, which is equivalent to the formal long-term care cost, which is also about 6 trillion yen. This informal means, as presenteeism mentioned, it's about the cost of family that needs to be absent from work and not concentrate for productivity. So in order to do that, in order to overcome the situation, we're utilizing the ubiquitous existence of Wi-Fi radio, especially to detect early symptoms of dementia for a single living elderly. We have about 7 million of them, and how to extend a healthy life expectancy of the 7 million people is a critical milestone to extend, to sustain, make sustainable this hyper-aging issues that we're all facing.
Great. Well, thank you so much for that. As we know, neurological and brain health is amongst the most underdiagnosed chronic conditions. So anything that we can do to move the needle on that is definitely welcomed. Shalya, over to you. Again, this panel is all about preventative health, precision medicines. We want to prevent these chronic conditions, and we have an amazing panel of experts here addressing it from different perspectives. Shalya, can you share some of the innovation that you've been looking at and from what perspective? Thank you so much.
Thanks, Lisa. So I would like to just come up with, as I said, a bit of demographics. We have 3.7 billion people across the world suffering from oral diseases, and costs over $764 billion per year in direct and indirect costs. So on the basis of that, and because my forte is oral health, I thought of finding some way where we can detect oral diseases earlier. So by early screening, and because the problem with oral health is affordability, availability, and accessibility, we came up with an AI-driven solution, integrating early diagnosis, which can be done by both dental and non-dental professionals. So this can identify early risk patterns, personalize prevention, and monitor health continuously, which can make oral health accessible even beyond the dental clinics. But this is what invites new kinds of collaborations. One, and I love it that we are talking in Japan, because Japan has an aging population and it has a huge amount of data. The oral health services in Japan are amazing. I was reading about it. The maximum, even insurance covers more than 70% of some of the healthcare. And we need to expand that solution to India, because in India by 2050, 1 in every 5 Indians, approximately 346 million people, will be above 60. So I would love this platform to come up with certain kind of collaborations that can combine Japan's strength in robotics, AI diagnostics, and precision healthcare with India's scalable, community-driven frameworks. Thanks.
Thank you so much.
I can speak more, but I know that there is
well,
so
you
much.
know what? Let's get our wonderful audience in on the conversation. So we'll have 5 minutes now of Q&A. Just go ahead and I'm going to just ask our tech help to take off the spotlight so that we can see who's with us today. Just go ahead and raise your hand, and then we will come to you.
Lisa, can I add something, please, till the time someone asks the question?
Is yours the first question?
Yeah, no. For me, one of the options that I felt was about the funding. That's what I wanted to talk about.
Okay,
because
so
whenever there is,
we'll be moving to funding in a second. So
okay,
we're just
perfect.
going to wrap up the Q&A on the partnership side. I'm telling you, this panel is so hot. There's so much that everybody wants to share. We're going to get to that in just a second. But back to our audience and colleagues. Any questions or comments around anything that Paola, Shalya, Masato, Hiromi have shared, or myself have shared so far around structuring partnerships, AI, tech? I know you've heard a lot. There's going to be a test at the end. I'm just joking. Yes, if we can just take off the spotlight so that we can see who's with us. Or just go ahead and ask your question.
Maybe, Lisa, if you allow me, I'm actually curious to maybe ask a little bit more to Shalya.
Go for it, Paola. Go for it, please.
Yeah.
So our first question is from our panelist, Paola. Go ahead.
Okay. Sorry. No, I just wanted to continue the discussion because I think it was a very interesting discussion around, using, technology and data and sensors to kind of predict, disease and kind of, maybe tackle those diseases, right? So
absolutely,
I think that's also something that we are very interested into doing, of course. One of the challenges that, we face is always around data integration, and also, how do you define something that is validated enough and can trigger a response in a way that does not overwhelm the healthcare system. So I was just wondering, what is your perspective? Maybe Shalya. I think to all of you, what is your perspective on this?
Shalya, over to you. Thank you so much, Paola.
Thank you for that question, Paola. So I would just give you an example, a real world example of what I'm trying to do. So we've collaborated with a company, which is an Australian-based company, which has a AI platform in which on a smartphone, you can just click pictures. By clicking pictures, you get a status report of your oral health, plus some recommendations to be going to the dentist. Also, in case it's required, some product recommendations or how to, and my forte, I'm the chair of the Oral Health Literacy Division of the International Health Literacy Association. So I like to bring in oral health literacy as a major factor about taking care of your oral cavity. So by integrating all this on a single platform, one thing which this study has been done in Australia in aged care homes, and next month on 14th November, we'll be presenting this study in Harvard Dental School. So it's an amazing platform which allows you to which uses deep learning to analyze oral photographs and speech. And if you ask me, I also feel that it helps assess oral frailty, because one of my passions is about older people. It's the most neglected zone. No one talks about it. But in my 30 years of clinical experience, I'm also a dentist by profession. I've seen older people neglecting their oral health. In Japan, there is still insurance, but in India, it's all out of pocket. And it's expensive. I know it as a dentist too. So how can we use technology to create preventative care, predictive care, so that person knows how to take care of their mouths, how to take care of their dentures? I've seen patients who haven't removed dentures, who are hospitalized, and they are going through gastric issues and digestion issues and their malnutrition, but no one has ever bothered to look into the mouth. And interestingly, I must bring in the study that I found, which was a study in hospital in Japan. There is, whenever we go for a health checkup, because of the intergeneration, because of the interprofessional lack of knowledge between oral health, it's a siloed world of general and oral care. We check a ear, throat, everything, but we don't check the oral cavity. Just by bringing that, they reduced hospitalizations by already almost 40%. So what I'm trying in my own endeavor, by combining all that I have learned and known, is how we can promote oral health, timely screening, risk-based assessment, and education. And this platform...
Shalya, I have a question for you. You touched on something very important, and that's how data, AI, and tech is hopefully reducing the costs of preventative health and precision medicine. Can you just quickly just expand on that? And then Bilu has a question, and so once you wrap that up, we'll move to Bilu.
So the basic thing about data is that it's anonymized. So data, and there is something known as federated learning, wherein we can transfer data by maintaining privacy. And by learning through each other's experiences, we can join the best practices to come up with solutions which are required worldwide. It's something which I always say, that one thing which is common across 8 billion people is oral health. Not everyone would have cancer or cardiovascular diseases or diabetes, but they are bidirectional. But oral health care is required for everyone, and it needs to get beyond those silos. And data is something, because unless you have evidence, policy doesn't change. So that's an integral part.
I'm looking for the statistics, because as we know, and as you've mentioned, these are chronic areas, not accessible to everybody. It's only going to start to become accessible once the cost of it starts to reduce. And I believe that that's going to be one of the solutions that you're going to be putting forward. Bilu, over to you. If you don't mind turning your video on so that we can see you. And then if you can just quickly ask your question, and also let us know which of our panelists you're directing your question to. Over to you.
Thank you, Lisa. And actually, I'm not Bilu, but I'm Claire. I am Bilu's assistant. And
okay.
Thank you, because thank you. I heard all your discussion, and I feel really friendly because I was once graduated from Waseda University, it's also in Tokyo. But
fantastic.
I really acknowledge, thank you, that Japanese people really enjoy one of the longest life expectancy in the whole world, especially Okinawa people. But I want to discuss a very important concept with you, because you just mentioned that healthy aging and HealthSpan.
We only have about 30 seconds left, so just quickly, what is your question, and who do you want to answer your question?
I want to ask Ms. Paola, because about you said that the healthy aging, and because the concept of HealthSpan is kind of misleading and somewhat deceptive, because only healthy people can live longer lives, and those who live long lives are generally in good health, and they adapt good lifespan, like doing exercise and eat very clean, and just like the Hong Kong people and Okinawa and Japanese people do, they have already done that, and so as a result, they enjoy the longest life expectancy in the world. But in order to surpass the limit of lifespan, because the global life expectancy is is only 72.3 years. And even in the world longest lived regions such as Madrid, Okinawa, Hong Kong, Singapore, the average life expectancy is only 85 to 86 years. People who can live past 90 are already very rare. So do you think that this health span is kind of misleading because we really need something that can extend our lifespan? Yes, because
Understand. So to
people,
summarize, I think we have the question. Paola, over to you if you can address her question around the
Yeah.
difference between lifespan and health span and
Yeah,
her
I think
concern about it right
yeah,
before.
I think you're right. You know, depending on the countries, unfortunately, you know, the status of the healthcare is different. You know, in some countries, individuals can live longer, but I think our goal is also to increase the overall standard of care, right? So that's what we need to strive for. We need to continue to enhance the standard of care and democratize it towards the whole countries. So that's very important. So how do we address the disease status? How can we improve outcomes everywhere, independently of the populations? I think that remains very important. Also, I think there was also in the chat, the prevention is also something that is very important. So how can we build awareness? And how can we, you know, educate the population to all this practice? Some of those that Shalya was mentioning into the oral care, but also, you know, in different type of care as well. So there are many different things that needs to be tackled.
Thank you. Thank
Thank
you so
you.
much. Okay. And so we're now going to move into the next segment. We're running a little bit behind. So we're going to, for each panelist who's going to speak, I'm going to ask you to keep it to 2 minutes, 2 to 3 minutes. And so we're moving into funding and just moving on from what Paola was talking about. Innovation is great, but if innovation stays in the lab and never gets out to the public, it is not helpful. So we're going to talk about how do we build partnerships to fund all this amazing innovation and address the gaps that have been highlighted by both our panelists and also by our audience. And we're going to talk about really 4 areas, and I'll kick it off in terms of institutional and private capital. So as we have seen, really over the last 18 months, there's been a convergence of institutional capital, venture capital, corporate venture capital, and private family office capital. All these capital sources have been converging around innovation. Before, we used to have one on one side and another on the other side. But as we work to address the massive gaps that we have in terms of preventative health for chronic health conditions, it's become almost essential that the funders understand better what the issues are, but then also, frankly, the innovators are moving up the value chain to better commercialize their innovation. And the result of this has been the emergence of a new form of funding, really sort of an investor operator model where you have investors who are both operators and investors and operators that are moving into the investment space. This has resulted in the emergence of and growth of venture studios, where we have corporate venture capital launching their own venture studios. Certainly, we're already familiar with the academic and university environment having venture studios. But also we have seen where institutional capital, private equity has moved down into venture to almost incubate these companies and innovation and hence bring it to market faster. This is a great development because what it means is that innovation will no longer, hopefully, die on the vine. I would say they've gotten one round of funding, but then they didn't get follow-on funding. By having these partnerships with large pools of capital and very specific pools of capital that are dedicated for precision medicine specifically and for preventive health for chronic health conditions. I'm going to ask Masato to talk about funding. Masato actually has a track record as an investor himself, but I'm going to ask him to move away from his private background and give his perspectives on government funding. And then we're going to go to Shalya and Hiromi if they can talk about what they're seeing from a philanthropic standpoint. And then Paola will round it out in terms of some of the innovation that she's been doing in funding and crowdfunding at Johnson & Johnson. Over to Masato.
Thank you, Lisa. So Japan has shifted the government grant program most greatly to preventive care and preventive health solutions. And preventive almost equals to data-driven. And as Shalya says, we have abundance of elderly people data, and this is something we can leverage on. And there are a bunch of subsidy programs, and they're very lucrative in many ways. Although there's a caveat, which is especially for startups, you have to spend the money first and have the government inspect and approve that the money was spent as intended, and then comes the grant. So
it's more of
there's
a reimbursement. It's more of a
it's
reimbursement model.
a reimbursement program, and that creates a cash flow problem for many of the startups. So there's a funding opportunity for this deep tech, age tech startups, and still Japanese investors are somewhat reluctant to jump into this space, as my personal experience. So for global investors, this is quite an interesting opportunity, window opportunity.
Great. Thank you so much, Masato. Shalya, just picking up on, again, the opportunities in terms of building partnerships around funding, making sure this innovation gets funded. What's your perspective in terms of what you're seeing in the philanthropic world?
Thanks, Lisa, for this question. And the fact is that it's very difficult, but it's so required. So what I would suggest is that blended funding models are essential by combining philanthropic support, public investment, and impact-driven capital to de-risk early-stage innovations. But what are we are envisioning a collaborative ecosystem, and for that, philanthropic capital acts as the first risk-absorbing layer. It would bridge innovation pilots with institutional investors and government programs. It can provide catalytic resources to pilot novel interventions, while strategic innovation collaborations with investors will ensure sustainability and equitable impact. So I can say from my personal experience, the Smile India initiative, we are exploring co-funding blueprints with regional partners and abroad, because it is something which can, as a health economist, I can vouch for the fact that it can save a lot of healthcare costs in the longer term. And it's simple to do. So this kind of blended innovation and investment is very important. And philanthropic part is something that, as I say, for oral health, you're not doing it for anyone else. You're doing it for yourself 10 years from now. You're doing it for parents now, and you're doing it for your children 20, 30 years from now. So it's creating a healthier world for everyone. So that's what I would
Shalya
like to
makes an excellent point. As we also want to get out of the silos on the innovation side, we need to get out of those silos on the funding side as well. And if we're really going to be moving the needle in terms of innovation, blended finance is very helpful, because then you can structure for the stage of the innovation and the type. Hiromi, anything to add in terms of philanthropic or blended finance?
Yes. I'm also we are have the already innovations in the AI product, medical care, the company shape product, the the project. We hope the project will be application in Japan, also other country. The AI's product can make the different value. So the funding and understand your project can do what, can make what value is very important. So we association have the different partnership, can share some different project. Also the funding, a lot of funding is coming, join and check with the product as the project, and each other can funding to the product. So also Japan government gave some of the technology and make the innovation, some of the project also can give some of the money join to the project. So I talk in the world, AI is very popular, do innovation, some everything. So funding is look what funding looks your value. This value can make the water and give somebody. So I just talk. I'm association also have a lot of funding as join my association and look too much the project. If somebody have the want to understand more detail something, you can contact to me. Thank you.
Okay, great. Thank you so much. Paola, I think that you have something to talk about in terms of crowdfunding. And before you get into it, I'm just going to remind people that we're going to be wrapping up this. We are almost at the end of this amazing panel. So please be ready with some of the questions that you might have as we look back at some of the insights that they have shared. Paola, if you can share with us sort of your closing comments around maybe crowdfunding.
Yeah, so I think funding is definitely a very important element, and so I think is mentorship, right? In order to kind of nourish this idea and let them grow into breathtaking innovation, we really need to nourish them. So we have actually partnered with our colleagues in Johnson & Johnson Innovation. You probably know Johnson & Johnson is quite famous for bringing innovation in and really scout innovations from everywhere. So we do have a solid team across the world of J&J Innovations. So we have partnered with them to launch within the Smart Healthy Aging initiative that I've discussed before, to launch a couple of crowdsourcing campaigns to really get the ideas around technologies, new solutions that can really move the needle on the Smart Healthy Aging. Addressing some of the ambitions that I mentioned before. We have rewarded, some of the, we have just closed our last challenge around, we call those a quick fire challenge around Smart Healthy Aging, and we have just closed them awarding 4 innovators, 2 of them coming from Japan, which have been not only rewarded financially, but also they had access to all, the J&J innovation system. So the mentorship from internal resources, the network, also including, venture capital network, training on experience, I think visibility as well. So all of those are all things that I think are important to nurture innovations.
And what I find so exciting about what you've been doing and being a leader in this space is the fact that crowdfunding, it's so personal. There are areas that J&J is leading and J&J is supporting innovation with entrepreneurs. And what crowdfunding does, it allows us as an individual to be part of that, to be part of bringing that innovation to the market in our own small ways. So I think that that's fantastic that we have the opportunity to do that. Okay, so we have about 5 minutes left. Paola kicked it off the last time with questions to our panelists. I don't know if any of our audience have questions for the panel, and if not, certainly Masato, Shalya, or Hiromi, if you have questions for any of your other panelists. Where to start?
Okay, I'll start. So, as a researcher and a clinician, understanding finances, investment is not my cup of tea. I'm not very good at that. I can do my research very well. I'm passionate about oral health. I can come up with great solutions. But how do we make it happen? How do we get support in such a way that we get success? Like, I think the solution is amazing. And also because I'm not just a researcher, I've also been a clinician. So I understand what are the real world implications, how would it work? But I need someone to bridge that gap between the funding and the real world implementation. So is there any support system? I could ask Paola that for now. And also,
Well, so I think we'll get Paula's perspective. I'm going to just answer as well. We have actually launched a just to recap sort of where I sit in all of this. You know, we run a venture capital fund investing in precision medicine and preventive health or chronic health conditions. We also have an affiliated research institute whose goal is to not only do the innovation, but also to commercialize this innovation at scale globally. As part of this, we have launched our second venture studio. It'll be accepting up to 40 companies, including 10 from Singapore, 10 from Japan. And Charlotte, we do exactly what you just asked. So we work with companies to commercialize. We support them on the R&D and the innovation. We also support them on the AI tech data analytics, scaling, global expansion, transfer, and we support them anywhere from 6 months to 3 years. Now, there's always, or sometimes there's a concern around, well, how does a venture fund this? There are different models depending on who they're working with, but what I should say is that it's not always about equity. Sometimes it's funded through recoverable grants. Sometimes it's funded as a percentage of revenue share. Sometimes it's venture debt, which has been taking off. And then, of course, sometimes it's around equity. So that is certainly one area. I'll just quickly touch on the challenges because, again, as I was mentioning before, you have, unfortunately, more innovation sitting on a shelf than actually is being commercialized, and it's getting it out there, not just at the early stage, but taking it right to scaling it for the masses. And there's a couple of challenges to be addressed apart from funding. Certainly it's around the data, where the data is coming from, the caliber of the data, the quantity of the data, and making sure that you have good access to data. Also, where do we start in terms of the actual innovation? When it comes to healthy aging and longevity, unfortunately, there's a lot of noise out there, a lot of fluff, which really is not based on science and moving the needle. And then also it's making sure that these companies are positioned to scale. If they are operating in a silo, they are going to go out of business very, very quickly, especially in this age when you have AI, which is completely revolutionizing how quickly innovation can be scaled and the caliber of it. Paola, I'll let you wrap this up.
Yeah. So I mentioned, the crowdsourcing, we call it J Labs, so the network of mentorship that we offer to some of our innovators. Another, areas that we are looking at with the partnership that we have developed is to really co-create and co-develop solutions in areas that we are interested in. So pilot some new approaches, for example, for health prevention, for diagnosis, early diagnosis of disease. And then, in those areas, we can also scale up if we are interested. We are also discussing with some, universities and local government as well in Japan about how can we help, how can industry help mentoring, young innovators and moving the innovation within the value chain. So if we can create like a network of mentors that can really help the innovators, because sometimes there are also, not only, I think, the funding part based on, I mentioned it before, but it's also sometimes the know-how on, how to build a business that sometimes the academia people, they kind of lack.
Great.
I
Paola, I think you have
Muted
hit your
yourself.
mute button by mistake.
Oh, sorry. Where did you lose me?
Just as I think you were just wrapping up around innovators, need help on commercialization, which I think we all agree.
I couldn't
with
agree
you on
more.
that.
Yeah.
Yeah.
I want to go ahead and thank our amazing panel and all the insights they've shared. We never have enough time for such important topics. I encourage you to connect with them on LinkedIn, look at their websites, go to their LinkedIn pages for more insights. And again, thank you so much to everybody for your generosity in sharing your expertise and of course your time. And thank you also to our to MedGlobal for hosting this amazing forum, and also to our audience. Thank you so much.
Thank you. It's been a pleasure to be here. Bye.
Thank you.
Live a long and healthy
Thank you,
life.
everyone.
Thank you. Thank you so much.
Thank you all.